Hello, I'm Dr. Glenn DuPont from St. Petersburg, Florida, and I wanted to let you know about a neat little device that I've been using recently that I really like. This is the Denar Deprogrammer made by Whitmix. One of the reasons I like it is a flat permissive device. In other words, when I place this in a patient's mouth, it allows that patient's mandible to go anywhere they want. The other reason I like it is it can be placed on the upper anterior teeth or the lower anterior teeth and be just as effective. And so it's very easy and simple to place, and it's very effective. One of the reasons I would use this device is if I have a patient come in with muscle pain, headaches, muscle palpation discomfort, and I'm trying to figure out, is it occlusal muscle or is it some other intra-articular problem in the temporomandibular joint? Because this is a permissive device, I can place this in a patient's mouth, let them just rest back for 10 minutes and come back later and find out, see if the patient has improved. If the patient's muscle palpation tenderness has improved, if the patient's headaches have gone away, or at least diminished, I can be pretty confident that there is at least some component of a muscle occlusion problem in that patient. If I place it and the pain gets worse, and the pain is more toward the joint area, then I'd be more concerned that it's not as much occlusal muscle, it's more within the joint, within the temporomandibular joint, and then I would take further steps to diagnose that. And so let me go ahead now and let me show you how we would place this device in the mouth. So we're going to go ahead, place a couple of cotton rolls just to help keep the lips out of the way so we can see what we're doing. And we're going to take this device. Now, one of the reasons that I might place it on the lower arch is if these lower teeth were very crooked or one was higher than another, they're very uneven. Because what I want is when this patient moves around to be as smooth as possible. But most of the time, I'd say over 90% of the time, I place it on the upper as long as these lower anteriors are pretty straight. So I'm going to just place it in here. I'm going to just gently have the patient bite down, gently move way forward, way back, forward as far as you can, and back. I just want to be sure, open up. I want to be sure that the patient does not go behind the device or can come way in front of it. I want that lower anterior teeth, these lower incisors, to stay on the device no matter how far forward or back this patient goes. That's why this device can be used in a class 1 or a class 2. You might move it a little forward in some situations and maybe move it back on a class 2. But just be sure it doesn't go beyond those, the front and the back. An easy way to place this is with just some bite registration material. And so here I'm using some AccuFlow material. Put enough in. You don't want just a little. You really want this locked in pretty nicely. You don't want it to come loose. Whale tail. You have it over there? Mm-hmm. So I'm going to place that in the middle. I like this whale tail here. Bite down gently. That's all. Good. Open. What I want to do is place this so it's perfectly parallel with this occlusal plane or the Frankfurt plane. I really don't want this device tipped back or tipped forward. I don't want it tipped like this or like this. I want this perfectly parallel. And this helps me accomplish that. It just helps me see it a little easier. And I'm going to wait now. I don't want the patient to bite. If they bite, it might loosen it a little. I'm going to let that set as hard as it can get. And now gently bite down. Okay, open. Let's place some articulating paper in. Go ahead. I'm going to just let your jaw relax gently. Slide forward, all the way forward, and all the way back. Forward and back. Open. Yeah. So I can see very clearly this patient is not coming off the back or coming beyond the front. Let's put red in. Bite down. Gently slide right and left. Open. And I can look at the pathway of that also. What you want to be sure is when the patient bites down and slides left and right, that they're not catching, especially on these cuspids, that the cuspids are not bumping as it goes through. You want to have it nice and smooth and even, just like this is. Bite down, left again, right, nice and smooth, forward and back, as far as you can come. She's coming right to that edge. Can you come any further? Good. Go back, forward, back. And so that would be something I could let her relax on and give her 10 minutes and then come back and see how she's doing. Another usage for this is when I come back and the patient's more comfortable, now I can take a bite registration. Now if I'm going to do that, I'm going to clear the back a little bit, open up. I'm going to slip this off. And you can see how the contact only went back to here. I can cut that off, make it a little more comfortable, and I can get a bite registration with that in the mouth. So I can trim this as long as I don't trim it to the extent of her excursions here. I can trim that off on a class 1 patient like this. Right to that point. You can use high speed or slow speed. I like this because it's nice hard material. Now I want to smooth that up so the patient's tongue doesn't play with it. And then I can place that right back in the mouth. And bite down now. Slide forward and back. Good. And we're still on it. She's still slide nicely. Now whatever kind of bite I want to use, I can place in the back. So if I wanted to use a putty bite, I would simply take a look and have an idea of how much I need to place on here. Let your jaw relax gently. And I can close right in there and establish that bite relationship. And just let that set a little bit. Open. And make sure I've captured the cuss tips, which I have. Now another neat thing about this is if I'm having trouble manipulating a patient, I can go ahead, let's mark it again with articulating paper. I'll go ahead and place the articulating paper in, slide right down, slide forward and way back, forward and back. Good, open. And I can then see at the distal extent of that mark is the position I want to capture. That's closest to centric relation. It may be centric relation, I'd have to verify that. But that's closest to centric relation, some flowable. What I can then do is roughen this a little bit, right in that area, and then place a little flowable composite on there. Just relax, bite down gently. Go ahead and hit that tonight. We can polymerize that material, and that will give me a definite guide and the patient can actually close to that position time and time again, depending on what kind of bite registration material I'd want to take. Open. So you can see how that's a definite stop now for the lower anterior. Close slowly. I would only do this after I've verified that that's a comfortable position and I've gotten muscle comfort. Now that the patient can close, open and close, right into that spot, I don't even hardly have to manipulate at this point. They're closing right in. And that way I can take my bite putty. I can do my bite relationship with my bite putty as I've just showed you, or I could even use wax. And with wax, it's nice because it's cross-arch stabilized. And so it's different than having two pieces to try to position on a model. And so I'll heat the wax. Then let that heat soak in so it's nice and soft down both sides. And then I'll actually position this wax distal to this device. So I want to make sure I reach the bicuspids, but I don't want it hitting the anterior deprogrammer. My assistant's going to hold that. Hold the bite. Hold the wax. Let your jaw relax gently. Squeeze a little. Open. Then I'm going to trim this right down the teeth here to limit the extent of the bite. Now in trimming it, I've distorted it, so I have to reheat it and go back in. And now back over here. Okay. And let your jaw relax way back, way down. Bite into that. Shake it in. Open. Jaw relax. Close slowly. And so I can see that she's biting right into that indentation that we created previously with the flowable composite. Now I can adapt this so I get really good adaptation to the teeth. And I can take a little air and fill it. Open. Place it in some water, some chilled. This is just cool water, not ice water, just cool. Chill that a little bit all the way through, and then go back in the mouth and re-verify that we've had no distortion, no rocking, and we can see exactly what we want. Go ahead and hold that. Now we'll position it again. Stations is positioned in the wax. We can see tooth, wax, tooth. She's right into our indentation there of the anterior with the flowable composite. Now squeeze hard. Do you have any discomfort at all in either joint? Any tension or tenderness at all? So we verify that that's a comfortable position and we're all done. And so, to summarize, what I like about this Denar Deprogrammer is the width. It's a little wider than the others, so it gives me a little more stability. It's flat permissive. It can be used in class 1 or class 2 situations because it has enough length. You just trim it to the size that you like. I also like it because it develops great muscle relaxation. and it's easy to place. Just be sure when you use your bite registration material that you're using a very rigid material, not a soft, squishy material. You want to use a very rigid bite registration material, place it in the mouth, parallel to that occlusal plane, and let it set hard so it stays firm and rigid throughout your motions. That's it. Thanks.